Are you in every way woman?
Welcome back to Every Way Woman. We're talking breast cancer and in specifically treatments. And there are so many treatments. I mean, we've all heard of chemo and radiation. What does that mean, Dr. West?
Well, we should break them down. First of all, some patients just need to have the tumor excised. And I think somebody, Dr. Curcio mentioned, there's some very low-grade lesions that we just simply follow. On the other end of the spectrum are these very fast-growing cancers. So chemo basically is something that goes into a vein and it goes throughout the body and it poisons any cell that's in any part of the body.
So it's more of a whole-body approach as opposed to the local radiation?
Well, yeah, and the radiation is like, you know, when you have a chest x-ray, they push a button, some energy goes through, you see a picture because of the physics. Dr.
But do you become like radioactive when you're receiving all this radiation? I mean, there are some crazy stories out there that people say.
I don't think you become radioactive. We have so many women who are breast cancer survivors, and you know, with external beam radiation, a woman will get about 5,000 rads. You know, using that number to get her chest irradiated, and you know, she doesn't develop cancer back at that site 2 days later.
Because of the radiation.
Because of the radiation. I think people are, you know, there's this misconception about radiation therapy and even radiation that you get from a mammogram.
Okay, well, between radiation and poison, what are some of the side effects that patients experience with these treatments?
So, I mean, these guys know more about that simply because of the treatment.
I mean, radiation's a local therapy, so just like surgery removes part of the breast.
Real quick, what do you mean? It's local, obviously, but is it a machine? Is it like a laser gun?
Well, it's a machine
Yes, it's a
that
machine.
delivers these invisible beams, essentially. So it's just like if you got a chest X-ray, you know, there's a machine that takes the picture, delivers the rays, and then produces the picture. The radiation is just like getting an X-ray.
Except it's more focal.
Yes.
Because you're trying to kill cells, higher energy, killing the cells in that lumpectomy.
So it is painless. You're not being touched. You're not being pressed. You're not being compressed. You're lying down for a few minutes. It's a painless process. It's not like surgery where we're cutting something. It's non-invasive in that sense as far as sensation goes. There are other side effects though. I mean, women describe fatigue as one. Often a sunburn can be another side effect that you can have with radiation.
Sometimes they complain about burning and tightening in the skin. And what's happening there is that you're getting like the fibrosis. Think of that leather feeling. Things are getting very tight there because of that. But then that goes away with time, and they usually refer to physical therapy so that you can get that area to be massaged.
And not as like hypersensitive.
Exactly.
Another issue that you have to really think about is left-sided breast cancer. Young women, that there is some scatter to the heart. The radiation therapists are really good at minimizing that, but it's an issue. But we have new forms of radiation therapy, intraoperative, or a procedure where we can guide the beam so from within the breast. They're very fast, and they reduce this risk of having damage to the heart or lungs.
Yeah. Technology is really advancing. So chemotherapy is another topic, obviously. So that's systemic, treating the whole body, preventing those little microscopic cells that might have escaped the cancer from later on becoming a real cancer somewhere else in the body. That's got a long list of toxic side effects. They're usually limited in time. So once you're done with treatment, you move on with your life back to normal.
I've heard of, I understand the immediate, like the nausea and the, you know, the
hair loss.
Exactly, and the hair loss. We're familiar with those. Are there any lasting effects on any of the other systems that you wouldn't necessarily think are connected with a breast cancer?
Yeah, so that's a great question. Some chemotherapies actually affect the heart, and that can be a long-term effect. So the better we get with understanding breast cancer, the more specific we can target chemotherapy so it doesn't affect the heart or the other parts of the body.
What about fertility?
Oh, great question. So, especially in the premenopausal women, depends on where they are. If they're in their early 20s, likely even after chemotherapy, their fertility will be okay. But you can never guarantee, because a lot of the agents, we use cocktails for chemotherapy. We don't just use one drug, we use several drugs. Yes,
Not the good kind either.
not the type of cocktail you want to have.
Although sometimes they'll have an extra cocktail.
Exactly.
It doesn't come with the side of vodka.
No. But some of the medications can affect, you know, a woman's born with her whole life supply of eggs, so it can affect some of the future eggs and fertility issues. But a lot depends on the age of the patient. Now there's more and more studies looking at putting the ovaries to sleep while patients are getting chemotherapy in premenopausal women, and there's now found to be a higher incidence of them being able to go on and have a successful pregnancy.
So is
with
that
doing
almost
that.
like a mini menopause, if you will? Like
Yes.
just stops your menstrual
Exactly.
cycle?
Well, chemotherapy will stop your
Yes.
menstrual cycle while you're getting it, even in the youngest of our patients. But this kind of preventatively does it, because chemo's doing it kind of in a toxic way. This just shuts down the ovaries and makes them quiescent, puts them into a dormant state. Think
But
of hibernation.
It can also shut down your digestive system.
Yes, chemotherapy can do that. There's a lot of gastrointestinal side effects that people have with chemotherapy, and it can alter, you know, it depends on what their baseline constitution is too. Some people get a lot of constipation, some people get diarrhea, so it really
So
varies.
are they then taking medications to combat these side effects?
But I think the point to make that women have this idea of all these side effects from chemo for various cancers. For breast cancer, it's much more tolerable. Our patients do well. Frequently, they're getting a treatment every 3 or 4 weeks. Over that weekend, they feel like they've had the flu, and then they're often back to work.
Because often patients work through their treatments and they're living their normal lives. Often, not always, but it's possible.
But you brought up the question of the long-term treatment, and some of our hormone blocking pills will go on at least 5 years, and some of them now are extended. We're kind of gathering data now. We may put some women on hormone blockade for the rest of their life, depending on the nature of their tumor. And we're learning more and more. We keep saying understanding the biology, but we're learning how tumors tick, you know, what the mutations are, and then our treatment is more specific and less toxic and more
Absolutely.
effective.
And I'm so grateful for the advances that you continue to make in each of your respective fields. Thank you for that. More Every Way Woman when we come back.
Are you in every way woman?